What is telogen effluvium in cancer patients? Have you ever wondered why some cancer patients experience hair loss beyond the typical effects of chemotherapy or radiation? This phenomenon is known as telogen effluvium. It is a temporary form of hair loss that occurs when a significant number of hair follicles enter the resting phase of the hair growth cycle prematurely. Normally, about 10 to 15% of hair follicles are in this resting phase, but in telogen effluvium, this can increase to around 30%. This shift leads to noticeable thinning and shedding of hair across the scalp, although it does not result in complete baldness. In cancer patients, including those with testicular cancer, cervical cancer, and other reproductive cancers, telogen effluvium often arises as a side effect of the physical and emotional stress associated with the illness or its treatments. Treatments like chemotherapy, radiation, or surgery can act as major stressors on the body, disrupting the normal hair cycle. This disruption causes more hair follicles to enter the telogen phase at the same time, leading to diffuse hair thinning or shedding. Typically, this shedding becomes noticeable 1 to 3 months after the triggering event. The good news is that telogen effluvium is generally reversible. Unlike other types of hair loss that may cause permanent damage to hair follicles, hair usually starts to regrow within 3 to 6 months after the stressor is removed or the body adapts. However, the regrowth timeline can vary depending on the individual and the severity of the stress experienced. Diagnosing telogen effluvium in cancer patients primarily involves a clinical assessment. Healthcare providers will review the patient's history and conduct a physical examination. Gentle hair pull tests may reveal increased shedding. In some cases, a scalp biopsy or blood tests might be performed to rule out other causes of hair loss, such as nutritional deficiencies or hormonal imbalances. Management of telogen effluvium focuses on addressing the underlying causes. This may involve completing cancer treatment or correcting any nutritional deficiencies. Supportive care is also vital. Patients are encouraged to maintain gentle hair care practices to minimize further stress on their hair. Counseling may be offered to help manage the psychological impact of hair loss, as this can be a challenging experience for many. In summary, telogen effluvium in cancer patients is a stress-induced, temporary hair loss condition triggered by cancer treatments or the illness itself. It leads to diffuse hair shedding but typically resolves with time and supportive care, without causing permanent damage to hair follicles. If you or someone you know is experiencing hair loss during cancer treatment, it is essential to consult a healthcare professional for personalized advice and support.